Are you ready to discover some shocking truths about women's health that your doctor may not know? In this opening presentation, Dr. Rachel Rubin, in July of 2025, at the FDA panel expert discussion on use of hormone replacement therapy and menopausal hormone therapy, a leading expert in sexual medicine, reveals surprising facts about menopause and hormonal health that could revolutionize the way we think about women's wellness. Stay tuned as she challenges outdated medical labels and shares vital information that could improve millions of lives. What you're about to learn might just change everything you thought you knew about women's health, in particular, hormone replacement therapy and menopausal hormone therapy. I'm Dr. Michael Lenz. I'm a pediatrician, internist, clinical lipidologist, and lifestyle medicine physician, and author and host of the Conquering Your Fibromyalgia podcast.
All right, our next presenter is Dr. Rachel Rubin. Go ahead.
Thank you. I have no disclosures. Good afternoon, and thank you for this life's honor to advocate for change. Science evolves, and so must our warning labels. I'm Dr. Rachel Rubin. I'm a urologist and one of the few fellowship trained in sexual medicine. It was the persistence of one person during an expert roundtable that I think changed the world. In 2014, experts gathered to change an outdated term, vulvovaginal atrophy, used to describe vaginal dryness and painful sex. It was my mentor, Dr. Irwin Goldstein, who helped pioneer Viagra, was the only urologist there. He insisted on adding the word urinary, shifting the focus to the genitourinary system and making it clear that this was not just a gynecological issue, but a full body health issue. The new term became GSM, Genitourinary Syndrome of Menopause. The truth is, menopause is a castration event which drastically worsens the health of the genitourinary tissue, and without hormonal support.
This is such a crucial point that often gets overlooked. We really need to understand just how significant these challenges are for women's health.
It never fixes itself. The genital and urinary tissues are full of estrogen and androgen receptors. Like a plant needing water, without hormones, we see changes in the microbiome, a loss of acidity, and a decimation of the healthy bacteria, which translates into symptoms like urinary frequency, urgency, recurrent urinary tract infections, vaginal dryness, and pain with sex. Every day, I climb on my soapbox and educate nonstop to patients, clinicians, and my social media followers about the genitourinary syndrome of menopause and the magic of local vaginal hormones to cure it. And holy moly, are vaginal hormones magical.
This is huge. Most people only think of Viagra when it comes to sexual health treatments, but Dr. Rubin is pointing out something far more impactful for women. Local vaginal estrogen and DHA don't just improve sex and comfort, they actually prevent infections that can land women in the hospital. And the data backs this up. Studies show that vaginal estrogen reduces urinary tract infections by more than 50%. That's not fringe science. That's decades of clinical evidence. It blows my mind that such an effective, low-cost treatment has been overshadowed by fear and outdated warnings.
Here's the secret. Local vaginal hormones, estrogen and DHEA, are not only similar to, but actually way better than Viagra. Because not only do they help with sex and urinary symptoms, they prevent urinary tract infections. Big time. This guideline-supported fact says that we can prevent more than 50% of people's urinary tract infections with local vaginal hormones, and we have known this for decades. So why haven't you heard of this before? Because your doctor doesn't know this either. And because, my friends, women's health has a marketing problem. UTIs, by the way, don't just mess with the quality of your life. They kill the people you love, a lot of people. And it costs us taxpayers a lot of money. UTIs cost 7 million hospital visits a year and make up 25% of infections in older adults. Mortality from UTIs is rising, and we all know that chronic antibiotic use is extremely dangerous. A 2024 publication by our sexual medicine research team showed that if women in Medicare used vaginal estrogen, which the cash price can be as low as $13 a tube, we could save our government billions of dollars per year in reduced UTI costs. This is why my colleagues and I have spent the last 7 years advocating for the American Urological Association clinical guidelines on GSM. Endorsed across multiple specialties, these guidelines clearly state that local vaginal hormones are safe, effective, and essential. And yet, FDA, your box label that was blanketly placed on all products in 2003, has no data to support its existence when it comes to these local vaginal hormones. And it scares patients and clinicians daily. Surely, 22 years later and consensus guidelines later, this deserves another look. There is not a single study in the literature that says local vaginal estrogen causes stroke, blood clots, heart attacks, breast cancer, or probable dementia, which is what your box says. Not a single study. But FDA, I'm actually here for a personal reason. Honestly, your label tried to kill my mother. She was in the ICU for 6 months. While in a coma, immunocompromised, and with a catheter, the team refused to start her home dose of local vaginal estrogen. They had never heard of it before, let alone in the ICU setting. They justified their answer, their no, by saying the box says stroke, heart attacks, and blood clots. I rolled up my sleeves and I showed them the data and insisted urosepsis could quickly kill her. Once they realized I wasn't backing down, I had the data behind me and I helped them write the prescription myself. But of course, the pharmacy wouldn't dispense it because their computer had a big warning alert that came up that said, warning, stroke, blood clots, and heart attacks. My family and I had to get even louder. When the tube of estrogen finally got to her room, we encountered another hurdle. The nurses had never heard of it and had no idea how to give it. My family figured it out. But what does everybody else do? UTIs kill our patients every day. So I'm here to beg you, FDA, use the appropriate channels and processes in place to remove that box label. My mom and family deserve better. All families deserve better. Thank you.
Thank you, Dr. Rubin. We're going to take a hard look at that. Thank you.
Excellent. Thank you so much.
What an incredibly powerful and important message Dr. Rubin has shared with us today. Her personal story drives home how outdated warning labels can have serious real-world consequences for patients. If you've learned something new about vaginal hormones and women's health today, please share this information with others who might benefit from it. Thank you, Dr. Rubin, for your tireless advocacy and for speaking up to protect women's health. Your work is truly making a difference. And why we talk about this on the Conquering Your Fibromyalgia podcast is that hormones can impact many women who are struggling with chronic pain, including chronic pelvic pain and genital urinary syndrome of menopause, as well as there may be an impact on the use of hormones for chronic pain related to fibromyalgia and fatigue, as well as overlapping conditions like ADHD. Now, more research needs to be done to see the impact of this, but I've seen it in my own patients. There can be a significant benefit on the use of hormone therapy for improved sleep, cognitive function, among others, as discussed in this series that we're doing through the FDA panel in July of 2025. If you haven't already done so, hit the like and subscribe button. That way, it will be easier for more people like yourself to get this information. Until next time,